Hey everyone, thanks so much for joining us. We're so excited to have LaDeana with us today, especially for Black History Month, but honestly, I'm always excited to have conversations with LaDeana. So this is going to be, I think, really informative and really good for us all today. So I just want to give a little background on LaDeana first before we jump into some questions. So LaDeana Artis is a licensed clinical social worker, and she's the Clinical Director of Outpatient Services within the Clinical Services Division of CarePlus New Jersey. So currently that's her position, but she's been with CarePlus for 21 years, which I never can believe, but she has so much wisdom, so I believe it. LaDeana has acquired extensive experience while working in various roles within the agency, starting out in the residential program as a mental health worker, supervised case management programs, and later advancing to outpatient programs, as well as intensive in community settings. LaDeana is a certified clinical supervisor as well and provides supervision for provisionally licensed social workers or LSWs as they work toward accumulating their clinical hours to become eligible for their professional licensure, as well as a CIFI, which stands for Seminar and Field Instruction Certified, and provides field instruction and clinical supervision to social work students and interns as they work towards the attainment of their Masters of Social Work, which is awesome because we have to keep the next generations going, right, and impart our wisdom. So LaDeana, thank you so much for being here with us today.
And thank you, Jen, for inviting me and having me here today. And sometimes I can't believe that it was 21 years.
Yeah, I'm sure.
I'm with you on that, but it's been a great experience.
Absolutely. Awesome. So we have a bunch of questions that we wanted to ask about, a lot of different topics. So we'll jump in with the first one. What importance should we place on awareness and education surrounding mental health in the Black community?
So, I mean, in my opinion, I think that it is of the utmost importance to increase awareness, access to resources, and providing more education in regarding mental health in the Black community. There are so many like misconceptions,
Yeah.
and there's also some fear, right, in the Black community of admitting that they might be experiencing mental health symptoms.
Yeah.
What does it mean to be depressed, right? What does it mean to be anxious, right? When the expectation a lot of times, and while I can't speak for everyone, just in general, the expectation is that you have this sort of like this mental toughness, right? So you
Right.
you get through, you function through it, you show that resiliency, right? So even accepting that there might be a mental health diagnosis
Mhm.
is very challenging for a lot of people. And I would say not only in the Black community, but just people of color.
Yeah, absolutely. And I think we're going to jump into even more of those kind of as we break these questions down.
Mm-hmm.
Being that this year's theme for Black History Month is the Black family, um, representation, identity, and diversity, all of these things that are so critically important. What awareness should we place on maternal mental health, specifically for women of color? Because we've been seeing a lot of things in the news, right, regarding mortality rate, and I think a lot of people are just uneducated on this.
Mm-hmm. And again, it goes back to the education, talking more about mental health, right? Normalizing it a bit. Some people do experience, and again, I'll go with, symptoms of depression. It does happen, and it's okay to ask for support if necessary. Right. So admitting that you're experiencing, again, depression or anxiety or any other, symptoms is not necessarily a sign of weakness or
Right.
failure, right? It could be, wow, I'm recognizing that I'm, not feeling well, right?
Yeah.
I'm recognizing that I can't give my 100% in any aspect of my life. I'm not feeling fulfilled. And that's okay, to admit. And again, I think that is very challenging because of, that overarching like expectation that you're just resilient, and no matter what is going on in your life, no matter what stressors, what challenging like life transitions have come up, you're able to kind of just pull yourself together and move forward, right, and function.
Right.
And when we talk about maternal mental health, right, for women of color, these are mothers, right?
Yeah.
So, and in the Black community, women of color, and again, I can't speak for everyone, but in general, what is the expectation of a mother, in a Black family, right? A lot of times they are, like that matriarch, they're kind of like, in control of what's going on within the family, within the household. They're kind of managing everything, right?
Right.
um and again, that's not the case for everyone, but it does happen quite a bit. I know even in my experience as a clinician, just as a person living in society, it's come up time and time again where,
Yeah.
the mom is managing the schedules, managing the household, managing the routines, any
Right.
behavioral challenges for their children. They're pretty much at the forefront of all of that. So for them to then admit, that they're struggling themselves, what
Right.
I've heard a lot of times is that they feel like they're failing their family, they're disappointing, their family. So again, and I know I kind of went off on a tangent, but again,
An important one.
in terms of like bringing awareness, I think again, more conversations, personal stories about,
Right.
women of color who have been able to, recognize and share, verbalize these symptoms of, again, depression, anxiety, or any, mental health challenges, and for those women who have reached out for support, who have reached
Yeah.
out, to get intervention and talk about their journey, and where they've come from and where they are now. I think that's also really important so that they're hearing, so that others are hearing directly from someone that they may find a little more relatable, right?
Right.
That it's okay and it can actually be helpful, to reach out for support.
Absolutely. So you've already addressed some of the next question, but let's get into it a little further. What stigmas surrounding mental health exist within the Black community?
So yes. So I think one of the most prevalent, amongst the stigmas again is that, mental health, when people hear mental, right, they almost equate it with a sign of weakness, right? It's almost like there's something wrong with you. You hear a lot, and I apologize if this is offensive to some, but you hear, they're crazy, right? So thinking about it in that way from such a negative perspective, you know, that definitely, contributes to the stigma that
Yeah.
exists, in the Black community. So who wants to identify with being crazy,
Right.
right? Or again, that sign of weakness,
Right.
so I think that, you know, those are definitely, stigmas within the community. And just to add, the misconceptions, right? That people who have a mental health diagnosis are violent, they're aggressive,
Right.
right? These are misconceptions. Not everyone diagnosed, with a psychiatric diagnosis is violent or aggressive, right?
Exactly.
So again, just those misconceptions. Um, and that's why, just going back to, our first questions, it's so important to have more discussions around, mental health, you know, um, and to provide more resources and to normalize it a little bit more so, that people who are experiencing some of these symptoms are not feeling so, you know, isolated or feeling like there's just something wrong with me and that there's nothing, that I can do about it.
Yeah,
Right. So,
absolutely. Yeah. And I think this next question kind of delves even further into that. Can you speak to the mistrust of the medical and mental health system and how this may affect access when help is needed?
I mean, this speaks to just, I mean, systemic racism, right? And constantly being faced with, discrimination, discriminatory practices. The mistrust in the healthcare system comes from feeling, you know, as if you're unheard, you're invisible, maybe you're not intelligent enough to understand
Mhm.
what's going on. So there are times when, and again, I've heard this over the years where healthcare providers, even mental health providers, are not actively listening
Right.
to, what the person is trying to express. Right. So I know that, definitely contributes to the mistrust.
Yeah.
Again, the systemic racism, discrimination, and then, not feeling as if you're heard,
Yeah.
and that your concerns are heard or validated, right? Or
Right.
even addressed. I'll go as far as to give a quick example of someone who, who I saw many years ago, who actually talked about um, basically feeling as if she was completely dismissed. Her
Mm.
concerns were completely dismissed, by her healthcare provider. And she knew something was wrong. She knew that something was going on, and this was more of a medical concern, but she knew, and the doctor basically told her, that it was kind of psychological.
Oh,
It was
gee.
all in her
Yeah.
head, and that it was not what she was, referring to. And it did turn out that there was, a medical condition. She was
Right.
experiencing those symptoms, you know. So, and honestly, I don't remember what the medical condition was. I just remember how challenging that was for her, that she had to go years, without this concern being addressed and how
Yeah.
that felt to her. And how it could have been addressed early on, and had not progressed to where it was once they actually diagnosed her. So,
Yeah.
again, just a general, example of that. But these are things that happen time and time again
Right.
because, you're unheard, you know.
Yeah, exactly. And I know you said it's just one example, but how many, countless other examples can people watching this even come up with, right? And
Absolutely.
we're seeing it in the news too, the lack of trust around the COVID-19 vaccine. Over the summer, we saw, and into the fall, a lot more coverage on Black and, people of color maternal health care. Um,
Hmm.
that has been more of an issue actually in people's brains. It's always been an issue, but I think maybe people are thinking about it now, which kind of leads us into just an offshoot of that question. How does mistrust affect Black women when they're trying to receive mental health services, specifically around the maternity piece, right? The maternal mental health.
Right, right. And again, I think it's very similar, you know. Again, you know, they a lot of times they may feel like, you know, they're going to be judged, right? Or, you know, they feel misunderstood, right? I heard someone recently say that, you know, when she spoke with her OBGYN about what she was experiencing, she felt dejected and dismissed.
Oh gosh.
By the OBGYN, you know, and this is, you know, and I mean, not to, you know, label, you know, but this is a woman who is educated, a licensed professional, you know, articulate, you know, able to describe, you know, very clearly, you know, not that, you know, others are not able to articulate it, but this is a woman who could articulate, this is what I'm experiencing.
Exactly.
And in her experience, she said that she felt completely dismissed, you know. So what do you do with that, right? You go home, you pull yourself up by your bootstraps, right?
Yeah.
And you function. And you function, right? And again, you lose trust in healthcare providers because again, you're feeling like, you know, you're invisible.
Yeah, exactly. Just, you know, like another confirmation of it, right?
Exactly. Exactly.
How do you think medication is viewed within the Black community? I mean, we're talking about mental health specifically, so I guess more psychiatric, but in general, what do you think?
So, I mean, in terms of medication, and again, you know, I definitely cannot speak for everyone, but it really depends. It really depends. It could be, you know, just again, that lack of trust in, you know, providers and, you know, and not feeling like that they understand you, they understand what you're experiencing, and that they have your best interest in mind. You know, are they just kind of, you know, diagnosing you and just kind of, you know, prescribing what they think is best without truly assessing, you know, what's truly going on for you, you know? So I think that again, it's just that distrust in the system, right? And feeling like, oh, you know, are you going to prescribe something to me that is going to be more harmful or do more harm than good, right? So there's a lot of anxiety around that, you know. And I don't know that that's unique to Black communities, but I know, like you had mentioned, just in terms of the COVID vaccine,
Right.
I've heard time and time again, and again, not necessarily unique to just the Black community, but I've heard it over and over again that, you know, I do not trust this. I will see, you know, what happens over the next year or so, you know, and this is while we're living in a pandemic. This is while we recently reached over 500,000, you know, deaths, fatalities, you know, due to the virus. And then you still have these communities of people that distrust the system so much that they're not willing to take that chance to possibly protect themselves and their families. You know, so it runs pretty deep. It runs pretty deep.
Yeah. And you know, not something that we can easily fix, but something that's a worthwhile endeavor for all of us in mental health and physical health world to try to overcome. You know, it takes a long time to overcome a systemic history of this kind of mistreatment, right?
Absolutely. Absolutely.
So this next question was, it was really like a question I was super interested in because this kind of came up a lot when I was in graduate school. And I hear from interns that it's still kind of the discussion. So I wanted to get your thoughts on it. So throughout the graduate school process, for mental health, whether it be social work or mental health clinician, we sort of have this larger discussion surrounding being a match for your clients, right? So the idea being, do we need to be matched based on gender, on race, on ethnicity, whatever it is, to be effective? Is that necessary? Is it not? Is it somewhere in the middle? What do you think?
So again, just in my opinion, I do believe that it is important to have a diverse representation
Yeah.
of treatment providers from different cultural backgrounds. However, I don't believe that it's necessarily, I don't think that it's absolutely necessary
Okay.
for there to be like a direct match based on race, ethnicity, gender in order to provide effective intervention,
Okay.
right? I think that's completely separate. So yes, to the diverse representation of
Yeah,
different cultural
absolutely.
backgrounds. However, in order to be effective, I think that depends on the rapport that
Right.
you're able to build, as a provider, the rapport you're able to build, your use of cultural competence, cultural humility,
Yeah.
right? Are you able to connect and make every effort to understand, right? Where the person is coming from, right?
Right.
So that I think is more so important. But again, I don't want to take away from the importance of the diversity, right?
Right.
And so I think that's
Yeah.
also very important.
And to be honest, I think if we had more diverse and equal representation, we probably wouldn't even have to ask that question, right? So, yeah, they kind of go
Exactly.
hand in hand.
Yes.
So this, in my numbers, the next question happens and occurs a lot to me in my work with school systems. So I'm wondering, from your clinical experience, do you feel there's a tendency to overdiagnose Black youth or Black adolescents, maybe even adults, with certain labels, right? And when I mean certain labels, I mean more of like our ADHD, our ODD, where they're defiant and all of these other things. What do you?
Mhm. So absolutely. Just to give a simple answer, I think that there's definitely a tendency to overdiagnose. And again, I don't know that it's unique to just the Black community, but I
Right.
do feel that, Black youth and, not to genderize, but, Black males,
Yeah.
you know, um, do are overdiagnosed with especially ODD and
Yeah.
ADHD. Are they really taking the time to truly assess what's going on with these children, right?
Right.
A lot of times when you see, ADHD, symptoms, is there, things going on at home, right? Is there, a history of trauma? You
Mm-hmm.
know, are they truly assessing what's going on for the youth? Right,
Right.
in ODD, my goodness. So if and again, I'm gonna go with Black males, but I think just in general, you even present like you're frustrated or angry, you're labeled as this like violent, aggressive child,
Mm-hmm. Yeah.
and could that be, stemming from some anxiety and not knowing how to articulate that, or not even understanding what's happening for you? You're just
Right.
reacting, acting based on these intense emotions that are going on. But of course, again, that further assessment, like
Right.
actually trying to understand where the child is coming from, it's just slap on the label,
Yeah.
you're angry, you're violent, you're aggressive. And that, may not be the case at all. It's
Right.
please help me, I'm really anxious in this situation right
Yeah.
now. Or, there are some traumatic things going on, not to mention,
Exactly.
you know, um, there's constant, trauma that, some of these children are faced with on a regular basis. And
Right.
I'll go into it, but just hearing a siren at times
Yeah.
causes intense feelings of anxiety, even if
Right.
you're completely innocent. It's
Yeah.
just, again, going to that systemic trauma,
Hmm. Right.
So again, I know I said short answer, it's a long answer, but
I
but
mean, it's a complicated uh,
mhm,
question, right? And there's a lot of layers too, because you're talking about what's happening to the individual, to the family, but also to their community, and then also to their society, right?
absolutely,
Yeah.
absolutely,
So
yes.
that it all comes together. And I know exactly what you mean, LaDeana. Having worked in a school for 3 years, I've seen some children become completely dysregulated when the fire alarm goes off and we're doing a fire drill. So I totally understand that.
Absolutely.
Do you think conversely that
Mhm.
there is a tendency to underdiagnose, especially while screening for these maternal mental health issues for women of color?
I think that could definitely be the case.
Yeah.
I feel that, women of color may also underreport, which may
Yeah.
contribute to the underdiagnosing. I mean, there could be so many different, factors that may play into the underdiagnosing, but I think the underreporting at times, and again, just going back to that distrust in the system, and just feeling like, if I were to express how I'm feeling, what is going to happen, right? That anxiety, that fear, are my kids going to be removed?
Yeah.
Am I going to be looked at as an unfit parent? What is going to happen? So
Right.
instead of looking at it as, a support, or, an avenue to get the resources in place that you need, or supports in place that you need, it's more like this anxiety inducing,
Yeah.
type of process. So it's like, am I going to tell someone that I'm having these intrusive thoughts and I have no idea where they're coming from, and I have
Yeah.
children that I need to take care of? Probably not, right? And
Right.
I'm getting ready to have a child? No, right?
Yeah.
Because I don't trust that you're going to have my best interest or my children's best interest in mind.
Right. Exactly.
So yes, I do feel like there's some underdiagnosing, and in part, I feel like it's because people are underreporting.
Yeah, I mean, especially if you bring in like the children family services angle, right? Like what would DCPMP have to potentially say about those things?
Absolutely,
Yeah.
absolutely. I didn't want to bring DTP into it,
Right.
but yes, that is
Yeah. I mean,
definitely.
it's part of the system though, to be fair. We're all layers of this system and we're all contributing to it.
Hmm. Hmm.
Um, we touched a little bit upon this already, but can you speak to some of the descriptive language that we use for clients of color? Like we talked about angry, aggressive versus anxious. And how does this further affect them within the mental health system, the school system, et cetera?
So I feel that, when those labels are placed on, just children in general, some of them start to identify with that. Right.
Right.
So instead of that further assessment, and someone really taking the time to say, this is anxiety, this is
Hmm.
trauma, and helping to provide intervention necessary so that they can overcome, some of these challenges or learn to cope in a more healthy, adaptive way. They're calling them angry and aggressive, labeling. And then, again, I feel like some just start to identify with that. Okay, so what's the point of doing anything different if you only see me in this way? Right. So I feel like that it affects the way that they identify, right? It affects their self-perception. And
Yeah.
sometimes it affects, how they, progress in their lives, right? Because if they're
Right.
feeling like, I'm just, worthless, just this angry person that's just always kind of dismissed, right? Or always kind of in the back,
Mhm.
because I'm too aggressive to be included,
Right.
right? I'm always
Right.
excluded. It affects them in a way where they develop these negative core beliefs, right? Not good enough, so I feel like that's how it affects them, you
Yeah.
know. And then it presents those types of negative core beliefs and those that
Right.
negative self-perception and identifying with something that may not be you at all, may not be where you're coming from at all, causes again, just very unhealthy decision making at times,
Yeah.
giving up on yourself, giving up on any goals that you might have had. And again, this isn't always the case. So again, I don't want to overgeneralize, but I think we've all seen that happen time and time
Right.
again, where you have these talented, intelligent,
Mhm.
kids who are just kind of labeled as the bad kid,
Yeah.
and you never get to that intelligence unless you really get to know them, because they're
Right.
constantly shielding it with that defense mechanism,
Mhm.
right? They're
Absolutely.
identifying with that defense mechanism.
Right. And exactly as you said, it becomes such a Pygmalion effect, the whole self-fulfilling prophecy. I was told I was angry, now I'm going to be angry, and then it's just my nature, right? How I'm
Mhm,
reacting to things.
mhm. And it's
Yeah.
unfortunate. It's unfortunate.
Absolutely. Yeah.
Hmm.
So in this past year, 2020,
Hmm.
it's been happening a lot longer, but 2020, a lot of things came to light, I think. We saw a lot of coverage on marches regarding Black Lives Matter and various peaceful protests, which for some was an awakening moment, but in reality, this has been centuries ongoing, right? Um, how does this level of systemic racism correlate with trauma?
Mm. So I think that I've spoke to this, several times, but again, just that constant exposure, to racism,
Mhm.
to um, implicit, explicit biases, you know, um, the fact that, just being who you are, the color of your skin,
Right.
right? Kind of dictating, how people treat you at times, or what you might have access to and what you might not have
Mhm.
access to. I think that's pretty traumatic.
Yeah.
I
Yeah.
think that, contributes to, being traumatized when it's, just constant exposure, you
Yeah.
know. So, I mentioned, hearing the siren, right? Why should that cause
Mhm.
alarm, right? When you hear a siren, usually what's going on? Like maybe they're going to get someone who's sick, right? Maybe there's a
Right.
fire somewhere. Maybe, there's something going on. So you should look at it as like, someone going to help,
Right.
but that's not the case because there's so much fear that, if you see me with my hood on, um, you know, am I going to be the person, that you pick
Yeah.
up, or am I going to make it home tonight? If
Right.
I'm in the wrong place at the wrong time, or I look like this, right?
Right.
So yeah, it's pretty traumatizing.
Hmm.
So I feel like that's what that level of systemic racism, that's how it correlates, you
Yeah.
know, with trauma in the Black community.
Yeah. And it's not like something you can just take off, right? You can't, when you get home at the end of the day, you can't say, okay, so now I'm not Black anymore. I took that off and I checked my trauma at the door. It doesn't work that way.
Right.
And this, just as a bit of a sidebar, is something that we have to educate more folks on, because there are a lot of jobs that have trauma within them, mental health clinicians included, right? But we can leave our mental health clinician hat in work and go home.
Mm-hmm.
You can't leave your visible identity that everyone can see
Right.
anywhere. It goes with you.
Exactly.
So
Exactly.
just like
Yeah.
another layer to it.
Right. Right.
Um, I want to end on a bit of a hopeful note. We've discussed a lot of things that are super important, and we know we have more work to do, but
Mm-hmm.
how can we kind of end on that hopeful piece? This is a question that we ask everyone that comes on and does an interview with us, specifically, about trauma. But I'm wondering, what do you feel enables someone to overcome a trauma history, especially as we consider everything we've just discussed and these implications for the Black community?
So one thing that I would stress is the practice of cultural humility. I feel that could be such, um, I guess, a great contribution to
Mhm.
positive change, and helping people to gain, you know, more trust, right? Because if we're practicing cultural humility, we're meeting people where they are, we're making an effort to understand them, right? So
Mhm.
they're no longer invisible, right?
Right.
Even if you don't understand every aspect of what's going on for them, you're making an effort, you're connecting,
Yeah.
right?
Absolutely.
So I feel like that is key, and again, just helping people to increase in awareness, increase their insight into, what signs and symptoms of trauma. What does that
Mhm.
look like? What does that feel like physically, emotionally,
Right.
educating. Again, education is always key,
Right.
education, again, awareness, insight, um, all of those things I think can, contribute to
Mhm.
um, helping someone overcome a trauma history, right?
Right.
You know,
Absolutely. And I just want to end by saying I completely agree with you. And I think that the onus does not need to be on the Black community for that necessarily, right? Um, I would hope that as individuals, people within the Black community could access services that could help them overcome a trauma history. But speaking as a white person, we have to do better. And I think truly here it's like we have to become more humble and more culturally aware and work on bridging these gaps. The onus is not on our Black brothers and sisters here. More again, that systemic issue.
it's systemic. I mean, I do feel that it's on both, that may be kind of the middle of the road, but I
Right.
feel like, everyone has to take some responsibility
Sure.
here, but at the same time, you're right, in order to develop more of that trust, you know,
Hmm.
and again, that trust, that relationship, that rapport is so important to
Right.
even getting through the door, for people to admit to what's going on for them, and allow you in to, talk about awareness to help
Right.
them, gain more insight in all of those things. So yeah, so
Exactly.
no, I absolutely agree.
Well, LaDeana, thank you so much for your time today, for joining us. Such an important topic, and maybe we'll be able to have you back again sometime down the road. But thank you so much for everything today.
No problem. Thank you so much, Jen, for having me. Yeah, thank you so much. I think that this was a great conversation. And again, I think that more conversations, need to be had, right?
Yeah,
I think there needs to be more discussions like this. So
absolutely. So
thank
the
you.
conversation continues.
Yes, absolutely. Absolutely.